My name is Amiel Bethel. I'm the chairman of the Department of Neurosurgery at University of Maryland, Baltimore, Washington Medical Center in Glen Burnie. I'm also a clinical assistant professor at the University of Maryland Medical Center in the Department of Neurosurgery. I went to medical school at the University of Pennsylvania and did my neurosurgery residency training at the University of Maryland with a fellowship at Johns Hopkins. I've been on the faculty at the University of Maryland for over 20 years. Operating on the brain and spine is one of the most exciting things that you can ever do. It is a calling, and you have to be ready for the intensity and the skill set to have the knowledge to do it, but it's a fantastic world. The best part of my job is easily the patients that I get to interact with and the ability to help impact their lives in a significant way. Many of the disease states that I treat are life-changing, and so many times I'm able to intervene and to make their lives better. My greatest patient philosophy is to treat the whole patient. I'm very excited to meet new people and find out about them and what things impact their lives, and to choose the best treatment plan for them individually. One of the reasons why I went into neurosurgery was because I was an actual sufferer of a concussion myself playing college lacrosse. And I found it was a very fascinating process going through the treatment for my concussion. When I started my residency training, I chose the University of Maryland Shock Trauma Center because my interest was in head injuries and brain trauma. I had done some minor research in that in college. And so for me, it's kind of a personal issue. I sat on the committee for U.S. Lacrosse as a neuro specialist for U.S. Lacrosse Sports Science and Safety Committee for over a decade. I try to stay as active as possible in the Baltimore-Annapolis area in club sports and high school sports when it comes to concussions and spine injury. I find the things that help train me for being in the operating room tend to be my fly fishing experience and some of my lacrosse experience. Being on a team, being part of a team is always very important to understanding how the operating room works. And of course, with my hands tying flies, it was very helpful for me doing some of the three-dimensional microscopic things I do in the operating room.